problems that you see?
I think the most common problems that we face in a home care situation is the environment and making sure that both the caregivers and the patients have enough room to safely perform the mobility or transfer that they're attempting to achieve. I think it's always wise to make sure you have all the equipment you need in place prior to making the transfer, making sure you have enough space to move safely, making sure your brakes are locked, making sure that there's no distraction, loud noises, that the patient is focused on what you're asking them to do, and they're very aware of exactly what the goal of the mobility or the transfer is. The use of two people is always a wonderful advantage. It provides more confidence for your patient, and it also just allows for that much more muscle if it looks like it's going to be a dependent or a very heavy lift or a transfer from one surface to the next, preventing injury to both you and the patient.
So you mentioned to me earlier some of the problems you see with somebody who's not very big or strong trying to move somebody who's bigger or more dependent. Can you say a little bit about that?
Sure. I think that a person of any size or stature, when using the proper body mechanics and positioning themselves effectively, will more than likely be able to transfer or reposition a patient effectively and without an enormous taxing effort when they're very aware of their body mechanics, using proper supports and moving with the patient versus pulling on arms, pulling on sheets, pulling on clothing. It's always a dangerous situation and likely to cause injury when someone is using those sort of pulling forces.
Pulling on arms or legs or sheets could be dangerous.
Very dangerous to both the patient or the caregiver.
What about having the person put their arms around your neck?
You see that very commonly, very common mistake. You never want to ask your client to help or to help assist a transfer by placing their arms around your neck. It puts an enormous amount of strain on your neck, and it just puts yourself at a huge risk. What we like to ask is that instead of that hug me, grab onto me, hang on me, we want to ask the patient to become an active participant in the transfer process, using their arms to best help them push off or reach to and pull towards versus assuming a completely dependent hanging position on their caregiver.
So you want to get them to participate and to help as much as
Yes,
possible.
that's right.
Is there anything else that people should be cautious about?
I think it's always important to be aware of the use of gait belts and transfer aids that will assist in any transfer from one surface to the next. If you don't have a gait belt readily available to you, you can always use a soft belt that you may have in your home. People will sometimes use a flat sheet, kind of make it thin, tie it around your waist. In the event that a gait belt isn't present, that can help serve the purpose. And again, I think it's always best to make sure your environment is safe and that your patient is on board with exactly what it is you're asking them to do.
Okay, great. Thank you very much.